and welcome to today's video where I'll be sharing my top tips for preventing vaginal tearing during childbirth. If you're new to my channel, welcome. My name's Anja and I'm a hypnobirthing practitioner. On my YouTube channel you'll find pregnancy, birth and postnatal related care tips. Don't forget to click the subscribe button and the bell icon because I upload a new video every single Tuesday and I don't want you to miss out on any important information. So my first tip for avoiding vaginal tearing during childbirth is to prepare your body for birth during your pregnancy. So one of the best things you can do is do some form of exercise every single day. Now it doesn't have to be anything strenuous, you could just go for a 30-minute walk every day. Doing some form of exercise every day during pregnancy improves the blood and oxygen flow around your body, and it also improves skin elasticity. During labour and birth, when your baby's head is coming out of your vagina, your perineum and your vaginal tissues are put under quite a lot of pressure. And if you haven't got optimal blood and oxygen flow going down to your vaginal and perineal tissues, they're more likely to tear. So doing regular exercise during pregnancy is going to boost the blood and oxygen flow all around your body, including to your vaginal and perineal areas, making you far less likely to tear when you give birth. It's also important to focus on good nutrition and hydration during pregnancy to support your skin and muscle health. So eating plenty of good fats from fish, nuts and seeds, avocados, etc., and also lots of fruit and veg, lean protein and plenty of water will help your body to stretch comfortably in childbirth and avoid tearing. My second tip is to do pelvic floor exercises during pregnancy, and these are also known as Kegel exercises. So when you do pelvic floor exercises, you're focusing on clenching and tensing the pelvic floor muscle and then releasing and relaxing it back down. And this is important for two main reasons. Clenching and tensing your pelvic floor is helping to prevent incontinence, and it's strengthening those muscles to stop you from peeing or pooping yourself during pregnancy and after you've given birth. And then the relaxing and releasing part of the exercise helps you to understand how to relax and release during the birth stage of labour. So when your baby is coming down your birth canal, the worst thing you can do is tense up your pelvic floor muscles, because that's going to restrict the amount of space in your lower pelvis and make it harder for you to push your baby out. And if it's harder for you to push your baby out and release your baby from your body, you're more likely to tear. So through doing pelvic floor exercises, it obviously helps to strengthen those muscles, but it also helps you to understand how to relax and release those muscles so that you can give birth to your baby more easily. And obviously if you can give birth to your baby more easily and smoothly, you're far less likely to suffer from any vaginal tearing. My third tip is to give birth in water if you can. Warm water naturally softens and stretches your vaginal and perineal tissues, and that's particularly important when your baby's head is crowning. The crowning of your baby's head is the time when your vagina will stretch the most, and it's also the time when your vagina is more likely to tear. And that's because your baby's head is the largest and hardest part of their body to expel from your vagina. And your vaginal and perineal tissues are put under a lot of pressure when your baby's head is coming out. Normally when your baby's head is out, your baby's body will come out a lot more easily than the head, but the crowning of your baby's head is the most intense phase of the birth stage of labour. So it's really important, if you can, to birth in warm water so that your vagina and your perineal tissues have the chance to soften and stretch more easily. If, for one reason or another, you can't give birth in water, if a member of your care team can place a warm, wet washcloth on your vaginal area as your baby's head is crowning, that can encourage that area to soften and stretch more easily so that you can avoid a vaginal tear. My next tip is to give birth in a vagina-friendly position. So some of the least stressful positions for your vagina during childbirth are to give birth on all fours, on your hands and knees, to be in a forward leaning position, either on your knees or standing up, or to give birth in a side lying position. My fifth tip is to use a hypnobirthing breathing technique when you're giving birth. because this will help you to work with your body's fetal ejection reflex and natural urge to push. Hypnobirthing breathing techniques are designed to help you to give birth easily and smoothly because they increase the amount of oxygen and blood flow going to your vaginal tissues, and they also help you to push your baby out with far less trauma to your vaginal and perineal tissues. So I recommend that you check out my breathing technique videos on my YouTube channel, practice them during your pregnancy and use them when you're giving birth. My 6th tip is to try and avoid having an epidural in labour. Epidurals will numb you from the waist down, meaning that you can't use your legs and get yourself into a comfortable birth position. Women who have epidurals usually end up giving birth lying down on their backs on a hospital bed. And what this does is it restricts the space in their pelvic area, making it harder for them to push and give birth to their babies. Also, epidurals numb your contractions, so you won't feel the natural urge to bear down and push. Due to this, the chances of needing instrumental assistance to give birth, like the use of forceps or vacuum extraction, increase. And these devices normally cause quite bad tears or cuts into the vaginal tissues. And my final tip is to do perineal massage from 34 weeks of pregnancy. Perineal massage is designed to stretch your vaginal opening and your perineal tissues in preparation for the crowning of your baby's head. And perineal massage is one of the best things that you can do during pregnancy to prevent tearing when you give birth to your baby. To learn how to do perineal massage, please check out the perineal massage video on my YouTube channel. Thank you so much for watching this video today. I hope that you found my tips useful and informative. If you've got any questions or queries about vaginal tearing and you want some extra support or advice, please leave me a message in the comments section beneath this video and I will get back to you as soon as I possibly can. And if you're curious to find out more about hypnobirthing, you can sign up to one of my free hypnobirthing taster sessions. I run 2 every single month on Zoom, so if you'd like to sign up to one of those, please click my website link in the video description below. Take care and see you in my next video.